The Rwanda Security Forces periodically provide medical outreach programs wherever they deploy. We do it in Rwanda, and we also do it in our deployments abroad, both in peacekeeping missions and bilateral interventions. So we've been doing it for quite some time. We believe in our operational philosophy that before you even provide security to people, you must provide human security. And health is an important component in providing human security.
It is our usual duty. We are used to. We are health providers, professional ones. So we were even expecting this situation before we came here. We knew that it is a big province where people have been displaced since a long time ago due to the war, where people were lacking health care services. So we were expecting before coming in, so we came ready, and we were having all the equipment and drugs to help.
So our forces participate in acts of providing medical treatment to the locals to win hearts and minds, because that's one of the counterinsurgency strategies. So you know that people left this province because of terrorist attacks. When they come back, they have to receive the requisite services, one of them being medical attention, which they need. So we provide that, especially in areas where the government may not be able to provide those services.
We move from our locations, our hospital, to go to the villages to find those population, because they cannot place themselves due to big distance. And then we reach the villages, we discuss with them the ways of preventive measures, and then we treat them. We make even some lists of those that we give rendezvous for big cases, like who need surgery, who need to be admitted. So we have a hospital, a referral hospital, level 2 clinic, where we take those who need to be operated at Afungi.
Whenever we are overwhelmed, so to speak, we always come back. So there is no limit to how much we can support. For instance, a couple of weeks ago, 260 patients were treated, but there were so many left, as you can see from the population that requires medical attention. So we keep coming. And we've trained for this, even during East African community trainings, medical outreach programs, civil-military relations. We treat up to 700 per day, which is a very huge figure. So we've been trained for this, and so we'll keep doing it. I think it's the right thing to do.
In this region, the common disease is malaria. It is occupying like 40% of all the diseases we are treating here. This is justifiable because it is in sub-Saharan region in Africa. It is an endemic region. It is an area where there is a lack of preventive measures. No one can sleep under mosquito net. You see there are bushes all over. So all of these go in favor of having malaria. The percentage, when we make a percentage on all the diseases we receive, this occupies 40% of all the cases we are treating here in Cabo Delgado. You see, it is more common because of the environment and the situation. So other diseases, as I was saying, it is there are those related to the situation, like disease related to poor hygiene, to malnutrition, to lack of preventive measures, there is no vaccination program here. There is this program that prevents like infectious diseases like HIV, like other sexual transmitted diseases. So all of these are common, especially malnutrition is common here. Even if you saw many people, you saw an overwhelming situation, but we assure you that we are controlling. We are trying our best every day to give what we have, to keep it sustainable, and we hope and we are sure that very soon this region will be also stabilized, as long as in security and in medical services.